Match the two parts of the sentence. Look at A, B, and C opposite to help you. 198A saw the UK launch of the attempt. Is J is meals, mumps, and rubella. Number two, chickenpox, varicella, is a common infection. E, disease of childhood. 3. Rabies has an incubation. Is A, period ranging from 4 days to many months. 4. The patient remained fever. Age is with peaks of temperature of 39.5 Celsius. He was admitted with a 4-day history of influenza type symptoms of fever with B. Is B rigor, malaria, and general malaria. 6. Keep a proportion of patients who recovers from hepatitis B. Is C become carrier of the virus. The central part of Africa is in the middle of an epidemic. Is F of AIDS. A. Meals rubella is most. D. Is infection during the cardiac stage. 9. Lyme disease is caused by transmission. G is of B. Burgdorferi from animal to man by exotic tick. M. T. PUO O stand for E. A. Pyrexia of unknown origin. Complete the case report of the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 minutes. He has palpable spasm. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis. Complete the sentence. Look at B, A, B, and C. Opposite to help. Number 1. An infection which can be treated successfully with antibiotic is curable. Another word from epidemic is outbreak. Bacteria and viruses are examples of microorganisms. Some whose temperature is normal is febrile. The common infection with Spain virus is known as glandular fever. Complete the table with words from A, C, T, and E opposite. Noun, affect. Adjective, affective. Anxious, anxious. behavioral, dementia, disturbance, suicidal. Make word combination using a word from a H box. To word can be used twice. Look at B, C, and E apposite to help you. Behavioral with syndrome, aiding with disorder, major is the with depression, personality with disorder, a facial with a retraction, sleep with disturbance, substance with abuse. Complete the sentence. Look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. Number two, a persistent emotional state is a mood. Number three, a sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called sleep dementia. And number five, a disorder which is not associated with pathological change is functional. Six, an idea which forces a patient to repeat unnecessary action is a compulsion. With which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 41. A 56-year-old woman present to her GP complaining of increasing tiredness over the past few months. She has lost interest in most things. She was sleeping poorly and tended to wake up little, but denying any suicidal tendency. She was 13 and was passing urine more often. She was eating normally and her weight was stunning. The symptoms is the patient has tiredness, loss of interest. Complete the table with words from A, B, and C opposite. Adjective, blind, no, blindness. Consciousness. Deafness. Dizziness. Numbness. Lightheadedness. And unsteadiness. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Double with vision, epileptic with fit, prodromal with symptoms, psychopal with attack, urinary with incontinent, and visual with acuity. A doctor trying to determine the cause of loss of concentration in a 52-year-old man. Completed the doctor's question. Look at C opposite and the table in 26.1 above to help you. Did you had a warning of the attack? What were you doing before you passed out? Were you boring or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? And did your wife notice any involuntary movement while you were unconscious? Table with words from A and B appositive. Noun, advance, adjective, advanced, diminution, diminished, flaccid, flaccid, expensive, expensive, washing, washed. A doctor is giving instruction to patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A appositive to help you. Number 1. I'd like you relax. I'm just going to move your arm up and down. Move down. Number 2. Can I see your hand move bulk and involuntary movement? Number 3. Now, I'm going to strengthen your arm out. 3 to stop him. Power. Number 4. Can you touch my finger with your hand touch your nose? Good. Now do it again with your eyes closed. Coordination. Complete the sentence. Look at A, B, and C apposite and at the table in 27.1 above to help you. A flaccid hand drops limply to form a right angle with the wrist. A musculation means the muscle is reduced in bulk. A tic is a form of involuntary movement. His coordination was poor. He could not perform rapid altering movement. A flex hamper is used to text reflex. When sometimes is voluntary, it is less than normal. A patient is about to A E in coma. When her name is spoken, she opens her eyes, but she does not answer question or obey instruction. What is her GCS score? A. Opening to speech. 3. Verbal response, none. 1. And motor response, none. Complete the table with words from A, B, and C opposite and relate form. Verb cur, noun cur, adjective curative. Excision, ground, growing. Highbider, habitation, high-bide. Obtrusion, obstructive. Palliation, palliator. Palpation, palpal. Spreading. Swelling. Note below are about the patient described in B apposite. Use them to put the sentence 1 to 9 in the correct order to make the next paragraph of the case report. Use Appendix 2 on page XX if you need help with the abbreviation. OET 37.8 cells. Cis. With on examination, his temperature was 37.8 cells. EMOT field 3x4 SM CM and mass in air supraventricular fossa. 3. There was a smooth firm 3x4 cm max in the right supravicular fossa. Node 1 to cm in diameter palpable to both axilla and inguinal area. 7. They were enlarged lymph node is both axilla. Ovarix nut. 2. His mouth and thorax were normal. P 104 minute regular age. His pulse rate was 104 min, regular and blood pressure 112. 12 to 66. ABD max bulbal 3 cm below costal margin. 5. On abdominal examination, there was mass pulpable 3 cm below the left costal margin. CNS and AD number 1. Examination of central nervous systems was normal. Complete the sentence. Look at A, B, and C are positive to help you. Distance speed of tumor cells is known as metastasis. 2. Many symptoms of cancer choose difficulty swallowing are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called cancer. And tumor which do not invade are metastases are begin. Secondary tumor are the those which result from the speed of a primary. If a cure is not possible, palliative treatment should be given. A public liver suggests metastasis. Complete the sentence. Look at A, B, and C are positive to help you. A baby that is born a week before the EDD is premature. A termination pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor is an indication for cesarean section. It was breech, presentation, and delivery was by force. Miscarriage is another term for a spontaneous abortion. The umbilical was worn tightly around the baby's neck, and it was unfortunately stillborn. Complete the table with words from A positive. Verb abort, noun abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation, and terminate, termination. Dr. Bennett and SHO is presenting a patient at the weekly meeting in the obstetric unit of a hospital. Complete this presentation with the correct form of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at the 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneous abortion. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weekends. In the second, she had an induction of labor at 39 weekends because of fetal distress. And the third baby presented on the breast and was delivered by cesarean. Make word combination using a word from each box. Look at A and B opposite to help you. Blood with stained, bread with song, plural with root, productive with cough, and vocal with resonance. Red, white, the question, using word that the better know to patient. And look at A opposite to help you. Number 1, is your cough productive? Do you cough up any phlegm? 2, what color is the spoon? Spoon is sputum. What color is phlegm? 3, is it ever pulluling? Is it ever yellow? 4, have you ever had hematophagy? Have you ever noticed any blood in? And 5, do you suffer from dyspnea? Any problem with breath? Are the following statements true or false? Give reason for your answer using your medical knowledge, and A and B opposite to help you. Number 1, a patient who has a low cough produces phlegm. True. 2, crackles are heard when the airways are not wet, nor wet. False. 3, a patient who has a non-productive cough produces sputum. False. 4, breasts are typical of pleurisy. False. And 5, a pleural roof is a sign of asthma. False. Over to you. Use the note below to write a case report and add your provisional diagnosis of the case. Use Appendix 2 on page 131 if you need help with the abbreviation. Begin, a 36-year-old man complaining of sudden right side chest pain. A 36-year-old CO sudden air chest pain with SOB right watching TV. Pain by the breast and coughing. SOB presents over the 4 hours from its onset to his arrival in AE. SL non-productive cough. PH and FH need prevalent. 3, 4, 5, 2, 52 holiday in Australia. OET 37.4 cells, RR 24 mean, and JYP 3 SM, PV 110 for 64, and P 128 mean. RS chest expansion because of pain. Pleural roof are lower some posteriorly, no other sums, others and 80. What is your diagnosis? Pulmonary embolism. Complete the declaration of herpes zoster shingles by replacing the medical word in brackets with ordinary English word. Look at A and B opposite to help you. Shingles, shingles, herpes zoster usually start with pain and soreness, then red spot maculas appears that develop into group small glitter basic over a particular area on, on one side of the body. In most patients, new spot glitter lesion continue to appear for 3 to 5 days. The small glitter become filled with pus, pustular, and the form scab crush. In the severe case, there may be scarred cicatrice afterward. Read the description of the rest of rubella and complete the note. Look at A and B opposite to help you. The spots are scattered pink maculas, which appear freeze begging the earth on the forehead. The rash spread rapidly first to the trunk and then to the limbs. Location and distribution freeze begging the course and the forehead, the trunk, grouping scalp length, type of lesion, maculae, maculas, and color pink. Complete the notes for the rash in the photography and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Widespread on the chest and abdomen. Groupish skeleton, type of lesion, small macula with some cell. Color pink. Complete the note of the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and the distribution. Below lateral of the left A. Grouping, single. Singlet. Type of lesion, noodle. Color bright or pink. Write the corresponding medical terms of the ordinary English word and say that kit of force, involuntary, look at A opposite to help you. Common word, bruise, medical term, contusion, type of force, blunt. Put inside wound, sharp. Brace, abrasion, blunt. Scratch, abrasion, blunt. Stab wound, penetrating word, sharp. Tear, laceration, and blunt. Choose the correct word to complete the description of the injuries shown the illustration. Look at A and B opposite to help you. There are grasses above the left eyebrow and on the left side of the neck a contusion to the left side of the lower lip and tear to the left cheek. Write a description of the injury shown in the illustration. Look at A positive to help 32.2 above to help you. There is a laceration tear on the left shoulder and on size wound cut approximately 6 cm above the left midline. And complete the sentence. Look at A, B, and C opposite to help you. Number 1. Frequent changes of a position are necessary in the immovable patient to prevent the development of a pressure sore. 2. He has several penetrating wounds in the abdomen from the knife. 3. He was diagnosed unsocial by a heavy blow to the head. And 4. The wounds were only superficial, requiring no treatment. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. CO frequency and nocturia for 1 year. No dysuria or hesitancy, strength or flow a little weaker. No incontinence apart from occasional dribbling. Match the patient description of her symptoms 1 to 7 with the medical terms A to H. And A to G, look at A opposite to help you. I have to pee every half hour or so. B, frequency. I get a scalding pain when I pass water. Is A, dysuria. I have to get up several times to pass water at night. E, nocturia. I have to rush to go to the toilet. F, urgency. I have trouble getting started. T is hesitancy. I can't hold my water. G, incontinence. And I passed some blood in my urine. C, hematuria. Write the doctor's question of each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question of urgency. Dysuria, do you have difficulty urinary? Frequency, how often do you come? Hematuria, do you bleed when urinary? Stancy, how long does vaccine acceptance last? Nocturia, do you urinary very frequently? Incontinent, when you large, do you let a little urinate? A doctor is talking to a patient during ophthalmoscopy. Marge, the underlying expression she used 1 to 4 two expressions with similar meaning from A apostrophe A to D. Right, Mr. Blood, because you have been having this helps. I'm going to have a look at your age, particularly the back of your eye, the retina. I'm going to put a clove or drops in your eye, which will make years from me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear off after about an year. I need to get rid of as much external light as possible. This may chlorine the bleed. Now I'd like you to look straight ahead at that clock. This takes a few minutes and your age may feel a bit tired, so you can blink if you need to. I don't want I don't want you look at me. Look at the clock. And A, the examination is done with dimmed lights. 3. Number 3. B, a topical mediatory solution is number 1. And C, to aid dilatation is number 2. And D, fixed on the target is number 4. Complete the instruction. Look at B opposite to help you. Number 1. Wrap the cuff around the patient upper arm. 2. Place a diaphragm over the area of the brachial artery. Raise the patient up so the brachial artery is at the same height as the hair. 3. Close the valve on the fist. 4. Pump up the pressure to at least 150 mmHg. Open the valve a little and slowly, daftly, the cuff will listening and washing the pressure gauge. 5. The first sound you'll hear is the flow of blood through the brachial artery. The valve on the gauge at that point in the systolic blood pressure. 6. Continue listen where you're slowly deflected the cuff. The diastolic blood pressure is measured when the sum completely dispersed. And complete the test, look and see a positive help you. Phlebotomists are especially trained in taking blood. They are skilled at very puncturing the vein to take a blood sample. The bridge, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it's difficult to locate an inserted vein, the patient may be asked to make a fist or a tourniquet may be applied of the upper arm to make the vein more abradement. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory where a full blood count or other investigation will be carried.